conducting FAIR 10 protocol a day. Speaking to imbecility suffers on their interests or household could assist enhance their quality assurance of lifetime. On to a research. Researchers transferred out a 9-month test in 69 thoroughness homes in England. 8-to-1 cooperation, combination in personalized thoroughness, considerably diminished the residents' wrath and excitement, the research found. The authors told some homes should try take a more than private attitude. Personnel in the homes were learned to find out on their patients' interests and abilities and ask them and their families questions on the thoroughness they acquired. The led to thoroughness how was more than personalized and turned on in time a 1 week of public cooperation. The could band of conversations on a patient's household, or interests such as kind of sports, to help them get portion in activities love horticulture or piece of music. The research found improved in quality assurance of lifetime, excitement and psychoneurological symptoms, in the big benefits for human beings in reasonably harsh imbecility. I believe which the is offering is how in fact comparatively easy things, if executed sturdily, can in fact do a actual distinction to human beings' quality assurance of lifetime. Professor Ballard told in lot thoroughness homes residents get as slight as 2 protocol of public cooperation a date. He told in lot thoroughness homes public activities were made in groups, such as in bingo hall, that frequently leftward a quantity of residents unengaged. Cooperating in them, and training on their interests and abilities, not just superior the quality assurance of their lives but as well done them facilitating to transactions in, he told. Professor Ballard told the could eventually assist bring expenses, both of in thoroughness homes and the broad public thoroughness framework. Yet, the research as well allocated problems in learning in the thoroughness segment, Professor Ballard told. He told down there were now 170 caregiver learning manuals accessible, but just 4 persons were relying on testimony how very treated, in manuals frequently utilized since of their price, quite rather than efficiency. How is just not nice quite, it has to changing, he told. Dr. Arktan, CEO of study at the Alzheimer's community, told, the research shows how learning to ensure the kind of individualized thoroughness activities and public interactions can include a considerable effect on the welfare of human beings residing in imbecility in thoroughness homes. It as well shows how the type of efficient thoroughness can bring expenses, that the extended public thoroughness framework desperate as necessary. Researchers told next job should see at how stable the treat would be for thoroughness homes through the nation. Dr. Sarah Imerigio, Chief of Study at Alzheimer's Study UK, told, in 850,000 human beings residing in imbecility in the UK and how quantity set to growth, it is essential how study in new drugs is linked in some approaches how can assist convert human beings as lives.